Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. I am Gami Salaboide. I'm a pediatrician, and it's my pleasure to be here today to discuss again with you another important topic with regards to the health of our children. Ask the Pediatrician Hour is brought to you by Ask the Pediatricians Foundation. On Ask the Pediatricians Foundation, we're committed to the health and well-being of all children globally, but especially in Africa, where majority of our children are still dying from largely preventable and treatable causes. And so thank you so much for joining us, whether you are watching me on the Facebook page for Ask Pediatricians Foundation or Fresh Ways Radio. I want to say thank you. Or if you are watching on our YouTube channel, ATP TV, thank you so much for joining us. And for those who are listening to us on Fresh Ways Radio or Ask Dr. Baby ATP podcast, you are also warmly welcome to today's episode. In the last few weeks, I've been talking a lot about vaccine preventable diseases. These are very terrible childhood killer diseases, but luckily we now have an arsenal, which is our vaccines, to prevent them, and so that our children do not have to die from these conditions. We have talked about diphtheria, and we've talked also about measles last broadcast. And today I'm just going to continue in that list and talk about tetanus. I'm sure most of you who are listening to me have heard the word tetanus before. It's one condition that used to be so feared and it used to be so common, but luckily it's beginning to reduce significantly, especially in the newborns, and that's due to our tetanus vaccine, tetanus toxoid vaccine that is available for preventing this terrible illness. So I want to invite you to join us today as we talk about this important condition. And remember that if you have any question about any topic that we talked about on this platform, you can always post your questions directly on Ask the Pediatrician Facebook group. Our Facebook group is open from Mondays to Saturdays, so feel free to post your question on this topic or any other topic or any health issues that affect your children on our Ask the Pediatrician Facebook group, and you're going to get answers from professionals. And if you have questions that has to do with your own health as an adult, you can also post it on our ATP Family Facebook group, and you will also get answers from our professionals there. We encourage you to follow us on our social media platforms to learn more all about your children's health issues. And on ATP, apart from what we do online, we also do a lot of stuff online. And our current project is the ATP Schools First Aid Project. We're going to our schools to empower our children with knowledge and also resources on how to do first aid care. And so we will appreciate if you can be part of this project. All the details are there on our screen for those who are watching. And for those who are listening, feel free to just reach out to Ask the Pediatrician on our email, askpediatrician@gmail.com, or our WhatsApp number. And we will also let you know how you can be part of this wonderful project. Thank you so much. So welcome everyone to ATP Hour, where we usually talk about important topics that affect the health of our children. And like I said earlier, today I'm going to talk about tetanus. I'm sure we all know, or maybe we've heard of tetanus before. At least most of us have heard about the tetanus vaccine, or what properly we call it tetanus toxoid vaccine, or TT. But why is tetanus so important? Why is it something that we really need to talk about? It's a very terrible infection. Tetanus is caused by a particular bacteria known as Clostridium tetani. So this Clostridium tetani tends to get into wounds, or the spores of this particular bacterium will get into wounds or cuts, and then it will lead to the person developing tetanus within 14 days. And so it is not like diphtheria or measles, all the ones I talked about, that is through coughing or through respiratory. No, this is not a person-to-person infection. This is somebody who has got a wound and which got infected with this particular bacterium or the spores of that bacterium, and that would now lead to the person developing tetanus. And tetanus is it's a very serious condition because of what really happened when the tetanus, the bacterium or a spores gets into the wound. It produces some products, okay, and that gets toxins, or let's call it toxins, that can attack important organs, especially the nerves in the body. And when that happens, the person will start having what look like neurological condition. They have what we call spasms, so, and then they will, they won't be able to control themselves, eat, or do so many things. And sometimes this spasm can happen so frequently, it can now lead to the damage to other organs in the body, especially the breakdown of the muscles, the kidney failure, and some people can die from there. So it is a very, very terrible condition for somebody to have tetanus, and that's why it is best avoided, prevented, rather than experienced, especially and even for our newborn babies, which is one of the reasons why even mothers, we need to know about tetanus, and we are the ones that will protect our babies. And that's why this is one immunization that is not just a childhood immunization only. This is immunization that is for everybody, including adults as well, because tetanus actually can affect anyone. It can affect both children, it can affect adults, but we are more worried when it affects newborn babies. It used to be one of our top killers of our newborn babies, especially babies that are born in unhygienic places, those who like to have the babies with the traditional birth attendants, where they may not have paid attention to hygiene, or what they used to cut the umbilical cord, and sometimes they even use things like cow dung and all that as for caring for the umbilical cord. And this used to be the main source or entry of the tetanus bacteria into the body and the spores, and that's what tends to lead to neonatal tetanus. And we used to, when I was training as a resident doctor in pediatrics, then we used to have lots of children who have tetanus in our outborn units, because most of these babies have been born with the traditional birth attendants and they've got infected. Most of the time, their mother didn't go for antenatal care, so they didn't have tetanus toxoid immunization during their pregnancy. So we tend to have these babies and they are just having spasm, and and sometimes we lose some of them, sometimes we save some of them. So it's a very terrible thing, but I think we are beginning to get towards the eradication of neonatal tetanus, because even the TBAs now, we're teaching them how to do things in a way that these babies will not have neonatal tetanus. So it is a very common disease. It's a very important public health disease, especially those of us living in low income countries where people don't get immunization. uh Tetanus can still be quite high, and lots of babies still die from tetanus, especially babies that are born where they are, they are not delivered in a very sterile or aseptic setting, where they use any instrument, the same uh blade or whatever is what is used to cause all the babies cord. These are things that can predispose these babies. People don't wash their hands, they are all contaminated and all that. So tetanus is really, really a public health issue, but thank God that there are more awareness about tetanus, and there are a lot of awareness about the immunization. So we are beginning to see less and less, and even people nowadays know that, oh, I have a bad wound, I have a bad cut, I need to go get my tetanus injection or vaccine. And I think that has led to a significant reduction in cases of tetanus. So let's talk about tetanus. So, what are the symptoms? How do you know when somebody has tetanus? Okay, so like I said, this the person who is going to have tetanus has to have been exposed to the spores, of that particular tetanus bacteria. So, and these spores get into the wound or the umbilical cord, even people that tend to have these ear infections, any terrible wound where there's little or no oxygen, and there's a lot of what we call it is an anaerobic environment where there's little or no oxygen. So the tetanus bacteria likes those kind of environment, and it tends to germinate in that. And within 3 to 21 days, then the person begin to have symptoms. So there's first the exposure, and then the incubation period can vary from 3 to 21 days, most of them within 14 days, and there will be we now begin to see the symptoms. And what are the symptoms of tetanus? Depending on the age group, but usually for the older children and the adults, they tend to have what we call locked jaw. It's as if they are not able to open their mouths. They can't open their mouth, as if their jaw is stiffened. And then later on, we're going to have this muscle spasm. Muscle spasm, it looks as if they are going to have convulsion, but it's not like convulsion. This is spasm. It's just as if you have like a shock. I'm sure some of us have seen it before. And this spasm can affect virtually all the muscles. And the people who are having tetanus, unlike a child who is having convulsion, they are fully aware of what is happening. They are not unconscious. So most time when children are having convulsions and they're checking, they're actually unconscious. They don't know what is going on. But those who have tetanus, when they have those spasms, they are actually fully conscious, and it's very painful. So you can imagine all your muscles suddenly contract and release like that. So sometimes, so it's a very painful thing, and it can involve virtually all the muscles of the body. It can involve the hands, the legs, the back, the abdomen, and it's very painful. So these muscle spasms are very painful, and they can be triggered by people, making noise or anything, even sudden movements. It will lead to spasm. The person will just, have that spasm. So, and you are very conscious. You are not unconscious. So it's very, very painful thing. So those are the two uh, typical symptoms that you see, and then you know that this person is having tetanus. The first, the locked jaw, and then the spasm start, and then also they can have difficulty with swallowing. Okay, they can have difficulty with swallowing, and like I said, when this spasm continues, they can lead to uh, injuries to other organs. So they have headaches, they can have fever, they can have excessive sweating, they can even have convulsion different from the spasms. And then, of course, the spores, the toxin, the tetanus toxin that is produced can also affect some nerves in the what we call the autonomic system. That those are the parts of the nervous system that regulates the heart rate, your blood pressure, and all that. And if those are also affected, then it will lead to fluctuation in the heart rate. It can become very fast. It can also lead to fluctuation in the blood pressure. So it is very serious thing. And some people may end up in ICU if they have very, very severe generalized kind of tetanus. Sometimes tetanus can be localized. In other words, it could be limited to only one part of the body, but sometimes it is generalized. It's affecting the entire body, the entire system. So that is more dangerous. Also, we also have tetanus in babies. And usually for babies, the horn is that most times they are not able to suck, and that's why when you mother say, "Oh, my baby's not sucking," it's not something trivial. We always have to be sure that child doesn't have neonatal tetanus, because that's one of the symptoms as well. So baby is not able to suck, baby is irritable, crying, and then they start having the spasms. And once you start seeing the spasm, most time it is very easy to diagnose tetanus. Tetanus is one of the easiest conditions to diagnose because the spasms are so peculiar to tetanus. So that is, once you say it, this is tetanus. So diagnosis of tetanus is not difficult because we see it. Once we see it, we know it, and then we can also figure out where is the source, where is it coming from. And usually for the newborns, it's very easy. Usually, most of the time, this is a mother who has not had antenatal care, who has delivered in a TBA, where they didn't follow all the usual hygienic procedure in delivering that baby, no hand washing, no sterilized instruments, and all that. So one of the campaigns we did was to say, even if you're going to deliver in your TBA, go with your own new blade so that they don't use the same blade, and they should wash their hands and all that. I think that's beginning to yield some fruits. And so it's easy for us to diagnose neonatal tetanus. And also for the older children, like we said, there may be a source of that wound. We will see it, and we know that this dirty wound that is not being properly treated, the person has, or somebody had or children when they have accidents. Sometimes children have accidents or injuries, and parents don't take it serious. It will just go away. So sometimes it's not, the wound itself or the injury itself is not the problem, but it is the exposure of that wound to the spores of this particular Clostridium tetani bacterium that we're talking about that can lead to tetanus in that child. And sometimes we end up, the treatment of tetanus itself is more expensive and very traumatic compared to taking an immunization long before you notice it. So it's very, very important that we avoid even tetanus at all, rather than after the child has developed the symptoms. So the World Health Organization has some criteria, that can help us to diagnose tetanus as well. Like I said, it's one of those conditions that is so straightforward and easy. So once we see the clinical features, once we see the symptoms, we don't need a blood test, we don't need a laboratory test. So once we see an infant, for example, for the neonatal tetanus, once we see a baby who is refusing to suck or cry, and then and who is not having spasm, it's neonatal tetanus. Whereas for those who are not newborns, for the older children, if they have what we call spasm, a sustained spasm of the either the face or any part of the body. Sometimes when they're having that spasm, to appear as if they're smiling, they are grin. It's as if they are smiling at you, look like an evil smile, but it's really tetanus spasm. And sometimes they have this, it's painful. Like I said, people that have tetanus, they are conscious, so they have painful spasms. So once we see those two, and then whether we get the history of an injury or a wound or a ear infection, then we know that this is likely going to be tetanus. So we've talked about tetanus, the cause of tetanus, how people get tetanus, and then we've talked about the symptoms of tetanus. And now let's talk about the treatment. So how do we treat tetanus? So tetanus itself, there are two major thing we try to do for somebody who is having tetanus. There's the symptomatic treatment. In other words, the symptoms, we try to deal with it. And then there's the definitive treatment, where we try to get rid of the bacteria that is producing the spores, and we also get rid of those spores, and we also get rid of the toxins that's already in the blood. So that's what we try to do. So it's an emergency. Luckily, like I said, we are not having so many cases anymore, but in some places it's still common, especially in rural areas where people still don't take immunization, and so we still have a lot. So any child who has tetanus is not something you're going to treat at home. That child is going to the hospital. It's an emergency. It's a medical emergency. So if a child is having spasms, a child is having locked jaw, there's fixed smile on the face and all that, then and there's the history of a wound or injury, or it's a newborn baby born at home or in the TBA and all that. A mother who never had antenatal care, who never had tetanus immunization, that child needs to go to the hospital. This is not one of what can I give at home. A lot of people like to ask questions on our group and will say, Doc, what can I give? This is not one of what can I give. This child needs to be in the hospital. So it's an hospital care. All right. So the first thing we need to do is that we try to neutralize all the toxins, the tetanus toxins that have been released into the blood. And so we tend to give what we call the human tetanus immunoglobulin. Before we used to give the OS one, but now we have which tends to cause some people to react, but now we have the human one. So we give that. That is supposed to neutralize all those tetanus toxin that can still bind to the nerves. So before they bind to the nerves, we to neutralize those one. We also give the tetanus vaccine as well, so that at least the body will also begin to produce its own antibodies to fight tetanus. So we give that straight away. Okay, then we want to get rid of where the bacteria and the spores are. So the wound, maybe it's the wound, it's the umbilical cord, or it's a chronic ear infection. That is where, so we need to clean it out. So we need to clean the wound. We usually, like I said, they don't like those wounds are wounds that don't like oxygen. So sometimes we even actually put oxygen on that, clear out the wound, remove it. Sometimes we have to excise. Sometimes you have to take the person to the theater and do a lot of what we call wound debridement. We need to remove all the dead tissues, because those dead tissues are the home that the Clostridium tetani bacteria love to live in. So we need to remove those wounds, all the dead tissue. We remove them, we'll freshen the wound, we treat the wound properly, we'll clean it properly, and usually our nursing staff will do the dressing every now and then, so that the wound will be clean, and that will actually get rid of the bacteria and the spores. Okay, that's the first thing. So at least we are not producing more spores that is causing those the toxins to get into the body. So we deal with the wound, and sometimes we give antibiotics, because there are antibiotics that can kill the bacteria itself. So we have things like metronidazole. It can kill, or even crystalline penicillin. It can kill the tetanus bacteria. So we give that antibiotics, we clear out the wound. All those is to make sure that the source of this toxin that is causing all this tetanus manifestation is dealt with. So we do that aggressively. All right. And like I said, we also neutralize already circulating toxins. Okay. So that's why we give the tetanus immunoglobulin. And then we also give tetanus immunization at the same time. We don't wait until the end of June. We start it straight away. Okay. And then we now do what we call symptomatic management. So the most serious problem or the most painful part of tetanus is that spasm. So they begin to have this spasm. They are always, and it's very painful. So what we do is to give what we call muscle relaxants. So we give what the diazepam, what you're commonly known as Valium. So we give it a lot. Sometimes we give it every 4 hours. We are giving it frequently. We are giving it in the drip. We are giving it as a bolus. We just want to relax the muscles and relieve the spasm. So that's what we try to do. If those who are having fever, we give them antipyretics, we give them paracetamol, we give them things to relieve the fever. We're monitoring them closely. Like I say, tetanus can affect the heart rate, it can affect the blood pressure and all that. So we need to monitor. So sometimes some people are so bad we have to take them to ICU, especially when it's beginning to affect the swallowing, it's affecting the breathing, it's ICU, because then we need to breathe for them. Sometimes we even need to do what we call a tracheostomy so that they can breathe properly. So sometimes because they cannot swallow food through the mouth, we have to give them food either in the drip, or sometimes we need to put in a tube into the stomach directly. So we try to do that, and hopefully we win the case. Like we get rid of the toxins, there are no more bacteria. We've destroyed through the antibiotics, and then we get the symptoms under control. So that's what we normally do. So it's a battle, and it's a battle we have to win as quickly as possible, because if not, we may lose the person. So some people do recover from tetanus. Okay, so even when people recover from tetanus, they don't develop immunity. So remember when I was talking about measles, once you have measles, we assume you should be immunized for life. In other words, you likely not have measles twice, so you will develop immunity against measles. However, in the case of tetanus, it's not the same. So people who have tetanus are not yet, they can still have it again. Okay, so they don't develop immunity. They need to still be vaccinated. That's why I say we start it even from day one, as we're giving the urgent immunization, the immunoglobulin to clear the already circulating toxins. We are also giving the tetanus immunization, the long-term one, and we start the program straight away. All right, so that is how we treat tetanus. Luckily, we're able to get some of the children or the adults, we're able to treat them properly, and after they recover, sometimes they will still need rehabilitation. Some of them will need physiotherapy and all that, just to get them back to the normal self. Unfortunately, especially for the newborns, we used to lose them a lot. But I think we are doing better now. So neonatal tetanus, we ought to have eradicated neonatal tetanus by now. We hold to, but because we still don't have what we call universal coverage, because neonatal tetanus is one of those conditions that is very easily preventable. No baby needs to have neonatal tetanus because it is so easy to prevent it. And so I'm going to talk about prevention. And let me just start from where I am now about neonatal tetanus. How do we prevent tetanus in newborn babies? The mothers, our pregnant mothers, you are very key, okay, in preventing neonatal tetanus in your babies. Okay, please make sure that you get your 5 doses of tetanus toxoids, you need to get it. So usually a lot of mothers ask questions about how the dosing and all that. It's a very simple regime. To complete your 5 doses, very simple. So it is either you follow a regime based on intervals, or you can take it with each pregnancy. So it doesn't really matter, just pick one. So you can do each pregnancy, you are supposed to take 2 doses of tetanus toxoid vaccine. So your first pregnancy, you take 2 doses. So that will protect you. And then your second pregnancy, you take your next dose. And your third pregnancy, you take another 2 doses. So at the end of the day, you would have taken like 5 in all. So it will protect you. But if you're not following that, we said if you take one today, that will be your TT1. In 1 month, take another dose, that will be your TT2. Then in 6 months, take another dose, that will be your TT3. Then 1 year after TT3, you take another dose, that will be your TT4. And then 1 year after, you take another dose, that will be your TT5. And we expect that should protect you for life, at least for all your period that you're having your babies, and your babies will not. So the main reason why we immunize the mothers is not primarily for yourself, to be honest, even though you're also protected for if you also get exposed to tetanus, but it's primarily for the babies. We don't want the babies to have neonatal tetanus. So if you as a mother, you have been immunized, then your babies will be protected against neonatal tetanus. But in addition to the immunization, please deliver your baby in a standard hospital. This is one of the reasons we want to deliver in a hospital. I know most will say, oh, I can deliver at home, or I can deliver with the traditional birth attendants. They are more loving, they are more caring, they are more sweet, than the orthodox nurses. I'm sure our nurses are trying their best, they are doing better. But please, there are reasons why you have to deliver in the hospital, and tetanus is also one of them, okay? Because the environment around your delivery has to be clean. Okay, so they have to be clean. People who are going to take your delivery, they have to wash their hands when they need to cut the cord. When your baby is out and they need to cut it, they need to use sterilized instruments. Okay, so people that deliver in TBAs, they don't, some of those who are not yet trained, they don't follow all these procedures. So most of them, they will not have ensure you. Some of you also do your antenatal care with them, so no immunization, and then the hygiene is not there, and some of the things they even put on you, put on the cord, some of them are live cultures of this Clostridium technique bacterium. So these are some of the reasons, and they use the same instrument for all the babies, not washed, not sterilized. The government, I know at least of Lagos State government, we've done a lot of training and retraining of our traditional birth attendant, because we know a lot of Nigerian mothers still like to go to them. So we want them to be part of our team. So we've trained them on how to do uh, hygienic delivery, how to use fresh instruments or scissors or blade to cut the cord, and not to use cow dung or all these your dusting powder on the cord. These are the things that put the babies at risk of having tetanus. So that cord care is very important. The cord of the baby is the gateway to all the germs. So that's why we say you must just clean it, either apply chlorhexidine gel once a day, or you use methylated spirits every 4 hours. Clean. The advantage of chlorhexidine gel is that you just apply it once, and then you can go and sleep for the rest of the day, and then the following day you apply another one, and you just do it like that for 7 days. So that will keep the cord protected from germs like Clostridium tetani bacterium that can cause tetanus. So if you don't want to use a gel, the methylated spirit, 70% alcohol, methylated spirit, just clean it every 4 hours, expose it to hair. Don't apply bandage, don't apply dusting powder, don't put toothpaste, don't put what other things people put? Cow dung, dusting powder, methylator. Don't put any of those things. Clean it with the methylated spirit and leave it exposed to air. That's all. Leave it dry. Don't cover it with metal anything. Don't apply hot water. Don't apply cold water. Don't apply lanta heat. Just leave it alone. The cord care, once we get the cord care and hygienic delivery, and the mother has taken tetanus toxoid during pregnancy, the babies will be fine. They are not going to have neonatal tetanus. And I'm sure that's why we have seen drastic reduction in cases of neonatal tetanus, especially in the urban areas. I mean, where most of us now deliver in hospitals, but maybe some of our villages and all that, they still need to catch up on that. So please, let's make sure we inform people about that. That's the most important thing. The delivery, it has to be clean, it has to be hygienic. The mother needs to get tetanus toxoid immunization, and it is free. So you go to your health center, they will give it for you, and you don't have to pay a dime for this immunization. So that is how to prevent neonatal tetanus. And for the older children, when our babies are born, we give them the routine immunization. And one of the vaccines that we give children is the tetanus toxoid. It is the T in the Penta vaccine. So the Penta vaccine is a 5 vaccine regime. Actually, for those of us in Nigeria, I know in countries like UK, some of them do 6. In other countries, they even do 7 that they've mixed together. So we are at 5 level now. So we have the diphtheria vaccine, which I've talked about. We have the pertussis vaccine. We have the tetanus vaccine. In fact, the 3 of them used to be together. We call them DPT vaccine, but now we've upgraded it to 5 now. So in addition to the D, the P, and the T, which is the tetanus, we also have the HIV, Haemophilus influenza type B vaccine, and we also have the hepatitis B vaccine. So we have all those 5 vaccines in one dose, and it is given as 6 weeks, 10 weeks, and 14 weeks. So please, our children need to take these vaccines. So when you take those vaccines, 6, 10, 14, it will protect your children till like about 18 months. All right. So currently in Nigeria, our vaccine tends to end around 15 months. Unfortunately, that's not where it's supposed to end. And the Pediatric Association of Nigeria, we are working so hard to see our government expand our immunization coverage. So we should actually have what we call booster doses. And one of those boosters that we should be giving is tetanus vaccine. We should be giving tetanus at 18 months. We should be giving it at 5 years and maybe even 10 years. So that's, because like I said, the protection of these vaccines tend to wane with time. And we noticed when I was in Lagos University Hospital, some of our children, they don't tend to have tetanus in the first 2 years of life, but once they are going to school, age of 5, 6, 7, and that's when the boys, they're very rough, they're playing, they're getting themselves injured, and sometimes they don't tell parents, they've stepped on nails and all sorts of things they get themselves into, and they don't tell us. Sometimes this is when they are now prone to developing tetanus. And what we normally recommend for parents, depending when we start giving the booster doses, is that please, if your child has any major wounds or injury, please ensure they get a booster dose of tetanus toxoid. And when you want to go for this tetanus toxoid, please don't take it in some private hospitals that are not, they are not standard private hospitals, because some of these hospitals, tetanus toxoid vaccine has to be kept cold. It is a vaccine. There's what we call cold chain. It must never be broken. So vaccine has to be kept at a particular temperature all their life until you give it. If you don't keep them consistently at that temperature, they will lose their potency. So, and if they've lost their potency, if you give those vaccine, he's just giving pure water. The child is not getting any immunization. The child is not protected. So we've seen cases where people will say, "Oh, we've seen cases of tetanus," and the mother will say, "Oh, yes, we took tetanus vaccine after the child has the wound and the child still have tetanus," because most of this, if you go to a place and they just take tetanus toxoid vaccine from over the counter or on the fridge, most of the time there's nothing inside. It is not. So most places where they give those vaccines, it has to be kept at a temperature, and we all know the electricity situation. So most places they don't maintain that cold chain. So the best place to get your immunization is at the health centers, general hospitals, because these are government facilities. They know the importance of making sure that these vaccines are this particular temperature all through, so you can be sure that what you get from them is potent. But if you go to private hospital, make sure it's a standard one. Ask them, where are you bring? How long does this vaccine in your fridge? Are you maintaining cold chain? I know some of them, so your own is too much, but please, it's better for your own to be too much and to make sure your child gets the right thing, than for you to assume that your child is protected, whereas the child is not protected against tetanus. So the children should have their routine immunization, the 6 weeks, 10 weeks, and 14 weeks pencha. But more importantly, they also, anytime they have wounds or anytime they have um any exposure to germs, maybe they have serious ear infection, anything that could could be a risk for them to have tetanus infection, please go and get a booster dose. So it's not too much. You can always get booster doses. Some booster doses come as diphtheria and tetanus. Some still come as DPT. Some come as tetanus and diphtheria. Different versions. But at least I know in Nigeria we have tetanus on its own. Just the tetanus toxoid vaccine, like the one we give to our mothers, so they are available in our health centers. So take your children there and let them get the booster, and make sure the wound itself, we have to clean wounds. Some of us, when children have wounds, we just don't take it serious, and if you don't clean the wound properly and dress it properly, it's easy for the bacteria, the Clostridium tetani, with the bacteria that cause tetanus. It's very easy to get into those wounds, and then we now start dealing with tetanus. So it's a very terrible, it's a very expensive disease as well, because when we give those the azepam, the children, they take it like as if they're drinking water. They have to take so much of it. They have to take a lot of doses of it. So it is very important that the children don't even have it. Whereas the vaccine is so cost next to nothing. In fact, you can get it for free most of the time in the health centers. So it is always, this is one condition again where it's very, very cheap, or cheaper to prevent than to treat. So, and of course, not even to talk of all the pain and all the things that go with tetanus. So we don't have to deal with tetanus. We can prevent tetanus. All right. So for the last almost 40 minutes now, I've been talking to us about tetanus. We've talked about the fact that tetanus is one of those vaccine preventable diseases. It's one of those killer diseases, especially for our newborn babies. But luckily, we now have a vaccine, and so it is something that is completely preventable. And so what we need to do is to make sure that our children got their routine immunization, and when they have injuries, even as older children, even as adults, let's make sure that we treat the wounds properly and get a booster tetanus toxoid. And also I've emphasized the need for our pregnant mothers. Please, one of the things you should be getting during your antenatal care is your tetanus vaccine. Some of us go for antenatal care in some private hospitals, and or some with our midwives, and all we just do is sing and dance, and people rub our tummy, measure it. It's more than that. There are some standard things you should have during antenatal care. One of them is tetanus immunization. Actually, in Nigeria, I know some of you say, "Oh, I live abroad," and they don't give us that, because tetanus is not a problem in some of those places, because they have standard health care. Everything everywhere is clean, everywhere is hygienic, and so they don't expect your baby to be exposed to tetanus. So some of them don't give their pregnant women tetanus toxoid. But in Africa, in Nigeria, please, we're still dealing with neonatal tetanus. So, and we don't have that such clean, we can't take those risks. Let's put it that way. Let's just put it mildly. We can't take any risks at all. So we have to make sure that you get your tetanus toxoid. You can take it from your second trimester. And like I said, you can complete your 5 doses outside of pregnancy, but you can also complete it if you don't want to be remembering, just remember, take 2 doses for with each pregnancy. Most of us will have 3-4 babies, so by the time you take the 3rd baby or 4th baby, you should have completed all your 5 doses. All right, so thank you so much for listening to me today. If you have any questions, as always, on tetanus or any of the conditions we've talked about before, please feel free to head over to Ask the Pediatrician Facebook group, and you can post your questions there, and we will try our best to answer your question within 72 hours. Most time we do it within 24 hours, but some of you have questions that only the professional can handle, and so you have to be patient with us. Of course, we always tell you, if it's something that is urgent, if it's an emergency, please do not leave it on the Facebook group. Feel free to go over to the hospital where you will meet our colleagues, and then they'll be able to support your child. And if you have any particular topic you think, oh, I really need you to talk about this topic, feel free to send me a WhatsApp message, and our WhatsApp number showing on your screen. Oh, for those who are listening, it is +234 9056 916818. +234 9056 916818. Or you can just email askthepediatricians@gmail.com, askthepediatricians with the X at gmail.com, and we will try and treat your topic in one of the future episodes. So thank you so much. And before I go, I just want to give my final advice about the Ask the Pediatrician Schools First Aid Care Project. We're going to our secondary schools all over Nigeria, and we're going to be teaching our children basic first aid care. We're also going to be giving them the first aid reminder tips cards and calendars. And we also want to give the first aid boxes to all the schools. And we want to reach at least 1 million children, secondary school students, before the end of this year 2023, and hopefully in the next 5 years we want to reach all the schools in Nigeria. So we want you to be part of this. You can donate to our accounts if you're in Nigeria, or both our Naira accounts or dollar accounts. And if you also want to give online, you can go to our global giving page. You can mix our global giving. Just go to global giving and search Ask the Pediatricians Foundation. You will see our page and our project and how you can give. And I want to reassure you that every money you give to us go into this project. None is used to pay for anything else apart from the project. So all our volunteers are volunteers. Nobody get paid for doing anything. So we really appreciate you being part of our project and for you to support us. So thank you so much for listening today, and hopefully next time we'll come your way again with another topic. Before then, please make sure you check your children immunization card. Make sure they are up to date with their tetanus vaccines, and make sure if your child has any wound, you check them when you're back from school today. Make sure it's treated. If they need tetanus toxoid boosters, please make sure you go and get it. And if you're a mom and you're still having babies, please ensure that you've completed 5 doses of your tetanus toxoid vaccines. And if you have not, this is another opportunity for you to remember to go and take your vaccine. So thank you so much for listening. So I come your way again, and next time with another important topic. Keep being healthy and have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.